Thanks, guys, so much. Well, 8 years ago, Patty Herbert was hoping to turn over a new leaf when she went back to school, but knee pain threatened her new livelihood until she sought the help of Baylor Irving. And after a total knee replacement, she's now able to shine in her new job as a real estate agent. And Patty, along with her doctor, Dr. R. Mills Roberts, they're here with her story. Guys, how are you today?
Good. Fine. How are you?
Good. Dr. Roberts, we'll get to you in just a minute. But Patty, as a real estate agent, I kind of want to tell your story about how this could have been affecting you, being a real estate agent, being on your feet all day and having this knee pain.
It was horrible.
Yeah.
It locked up basically during the time I was going to school, and that's when I sought a doctor, and I found Dr. Roberts, and we did many treatments. We did shots, physical therapy, and nothing worked until finally we said, that's it, it's got to have it done.
I've got to have it done. And I'm sure this is a case, Dr. Roberts, you hear time and time again, people who are suffering for a long time and then think, this is really interfering with my life.
Exactly. When Patty came to the office, she was really suffering. She had a really worn out knee.
I did.
We tried everything conservative. I think we worked on her knee for about a year. And finally, when nothing else was really giving her any long-term relief, we decided to go to a knee replacement.
And how does that exactly work? I know you brought this guy with you right now. How does the surgery work, and how does it rectify those problems that Patty and so many others have?
Well, Patty had was a minimally invasive total knee replacement, and minimally invasive means we're doing the procedure through a smaller incision. There's less muscle damage, less blood loss. We have to remove less bone. It's a lot quicker recovery. So patients get back on their feet a lot quicker.
So not only is it a good technique as a surgeon, but the good news to the patient with that minimally invasive is that the recovery is a lot shorter. And you are shaking your head, Patty, saying this. I'm sure you were a little overwhelmed by the thought of surgery and having a total knee replacement. What did you experience, and how did it go for you?
Well, the pain got so bad, surgery looked great to me. So I went in the hospital. I think I was there about 2.5 days. They had me walking the next day and went home, did all of the exercises, all of the things he told me to do. You have to do those. And I love it. I don't even know it's a replaced knee.
And Patty sat down next to you right before the segment started, and she looked at you and said, he's my favorite doctor. I'm sure for people who are suffering and think they don't have options and are a little overwhelmed by surgery, you give them their livelihood back. And for Patty, you were
my life.
Your life. And you're a real estate agent. Do you still practice?
Yes.
And that's a big part of your life.
Yes. I couldn't have done it if I hadn't had the knee replaced.
Okay. Well, Dr. Roberts, so many people like Patty may be watching and saying, this is something I think might be an option for me. So what do they do? What are the first steps? Because for Patty, it was a year-long process of trying to rehab, right?
Right. When your symptoms aren't relieved with over-the-counter medication, when you can't do the things you like to do, you need to do, it's time to come see your physician, see what other options are out there.
Okay. And so maybe we can even attend one of those seminars, too. I know that you offer some free seminars on the 23rd of April and also on the 21st of May. What's entailed there? Kind of a Q&A session?
Exactly. We're going to have these at Baylor Irving, and we're going to go over what the options are, what the latest and greatest treatment is, how to get back on your feet maybe without surgery.
You should hire Patty to go and kind of tell her story.
May have to.
Sometimes, you know, just hearing it from somebody who went through it themselves is the best way for maybe a new patient's mind to be put at ease. Well, thank you for bringing Patty today and sharing this new technique with us. And if you want to schedule an appointment with one of Baylor Irving's orthopedic surgeons, you could call 1-800-4-BAYLOR or log on to BaylorHealth.com/Irving, or you can go to BaylorHealth.com/GMT, and we'll be right back.